My name is Genesis, and I'll be doing my presentation on night eating syndrome. Now, you may have faced late night cravings at one point or another. However, if you experience night eating syndrome, also known as NES, then you know that this is a serious condition and is way more simpler than a hunger pain for a midnight snack. Night eating syndrome actually falls under the category of an eating disorder and therefore is interlinked with mental health. Eating disorders are much more than a desire to be skinny or overindulgence. They are distinctive mental disorders and should be treated accordingly. Many people are unfamiliar with NES since it is an emerging epidemic, so understanding the signs and treatment is critical to helping someone. What is NES? Night eating syndrome is an eating disorder that consists of a chronic pattern of late night eating. About 28% of obese people actually experience NES, so although it may not seem like an epidemic throughout the general population, it is a serious matter, especially among those whose health is most at risk. NES is mainly characterized as an eating disorder. However, it is also cross-referenced as a mood or sleep disorder as well. It is important to note that because its recent epidemics around it does not have an official diagnostic guideline. There are signs that you may notice, however, that may help you determine if someone you know is actually suffering from this. The difference between the two can closely be observed by looking for signs and symptoms. What are the signs and symptoms? People with NES tend to eat the majority of their daily calories after dinner, about 25%. They are not simply eating late at night, but are truly eating during this time. During these eatings, mostly carbohydrates are consumed. Because there are a constant late night eating pattern, people with NES also tend to skip breakfast and earlier meals. In terms of other related mental disorders, NES sufferers also are more likely to be depressed or have anxiety. Insomnia and other sleep disorders may also be present. In order for one's symptoms to be truly classified as night eating syndrome, these signs have to be apparent for at least 2 months. Causes. Some research shows that there is a correlation between the level of present of hormones in the body. People with NES tend to have lower levels of melatonin and higher levels of cortisol. Melatonin is important for maintaining our internal clock, and therefore, when levels are off in our body recognizes it whether it needs to be in a state of rest or recovery or alertness. Cortisol is associated with stress, which has been shown to be related to NES. Cholesterol affects appetite as well. Some people with high levels will experience an increased hunger, which may cause excessive eating. Mood disorders like depression and anxiety are also associated with these symptoms and are often coexisting elements, making NES even less distinguishable amongst other related disorders. Effects of NES. Besides being potentially caused by hormonal imbalance, NES can and often does lead to further hormone imbalance, becoming a serious health threat to an individual who suffers. Obesity is also another obvious threat to night eating, and thus all of the many consequences, health risks that come along with being obese. Because NES is related to sleep patterns, the interruption and lack of proper sleep has its own risk. Meanwhile, the others associated with mental health conditions such as depression and anxiety may lead to further behaviors like substance abuse. How to treat night eating syndrome. Night eating syndrome has been compared to addictive, as people express the overwhelming desire to eat and usually feeling guilty immediately following. The close link with mental disease allows for treatment to be geared around best practices for mental health and addiction management. Therapy that alters other hormones like melatonin, leptin, have also been used for the treatment. Behavior and psychological therapies are also beneficial as they deal directly with some of the associated factors of NES. Similarly, someone who has lived with NES over an extended period of time will likely need to consult with a physician and nutritionist in order to get the proper tools for leading an overall healthy life. Although NES is not on the radar of the general population, understanding the signs and related health conditions may put you in a position where you are able to recognize the illness in a loved one. It should not be taken lightly as it is a true disorder and a complicated one at that. So treating it requires multi-leveled approach. So, in other words, night eating syndrome is a eating disorder that causes people to wake up out of their sleep in a sleepwalking state and go get something to eat. They don't, some know they're doing it and some don't. And it's very dangerous in, of course, obese people, and that's where it's most common. As I stated before, almost 28% of all obese people experience night eating syndrome. Some causes of night eating syndrome is stress, depression, anxiety. Um, Treatment, there's not really medication for it, but in order to get treatment for this, you have to go to a physician and they have to monitor you for about 2 months. And if they find symptoms of this disorder, then they'll give you medication. Um, Signs is overeating, people missing meals, like important meals like breakfast and lunch. Those are some signs. Um, some other signs that I didn't mention before is that some people eat and then they'll throw it up just to eat it again, like anorexia or bulimia. Bulimia is eating and throwing it back up, and the acid from your stomach is destroying your insides. So people with this disorder, sometimes they'll eat it and throw it up so they're not fully, like completely full, and then they'll go back and eat again. And as I stated before, sometimes they don't know they're doing it because they're in a sleepwalking state, but the ones that do, it is very serious. And people who have heard about this and know the signs and symptoms, and they know somebody that's doing it, they should have that person get some help immediately because this is a very serious matter. Um, it can lead to obesity, overextension of eating, and sometimes death. Let's see. Some people also, what they'll do is they'll eat breakfast, they'll skip lunch, and they'll skip dinner. And in the middle of the night, they'll wake up, go in the refrigerator, and get something to eat. Because they've been starving themselves all that day just to eat in the middle of the night, because also eating is a way of comfort for some people. So with this syndrome, some people are trying to comfort themselves by eating during the night, or it helps them sleep during the night. So they'll skip all their meals during the day just to eat at night. And that causes them to be obese or other symptoms. Ways to stop it. You can go to the gym and exercise that way. Some people, I looked up different stories about this, and some people found that going to the gym and exercising and staying healthy, it makes them not want to eat as much. So they broke out of their night eating syndrome. Um, Eating disorders are conditions defined by abnormal eating habits that may involve either insignificant or excessive food intake. So some people can just like go exercise that off, or they can find ways to keep busy to keep them from thinking about food. Another story was a lady took up a hobby. Like, she was diagnosed, she had night eating syndrome for about 7 years, and she tried to find hobbies and stuff to get her from to stop eating at nighttime, and nothing worked. But her son-in-law took her to the gym, and after a day's workout she realized that she wasn't as hungry anymore. So that night she actually slept through the whole night. She didn't eat. So now she goes to the gym for 2 hours a day, and that helps her break her night eating syndrome. And that's about it for my night eating syndrome presentation.